what is TMS? And then I'm going to ask you, how does it work?
Okay, sure.
Yeah.
So rTMS, repetitive transcranial magnetic stimulation, is very simply put a treatment where we take a powerful electromagnet, much like what anybody would have in an MRI machine, but we
Hmm.
take it, we put it right upside the head. We place it on the scalp, and we're pulsing the brain with electromagnetic energy. All the studies have indicated if you do this repetitive pulsing session after session, day after day, that you can relieve all the symptoms of depression, obsessive compulsive disorder, and many other conditions. This is what we think of as a brain network treatment. That is, we're taking the electromagnet and we're placing it over a part of the head that
Hmm.
is the hub of a critical brain network. And by introducing energy into the hub of that network, the brain then spreads the signal throughout those many connections of the networks and reshapes them. We talk about rewiring the brain, forming new
Hmm.
connections, disconnecting old uh, connections that may be associated with illness, and therefore helping the patient feel better.
Can you say a little bit more about, so I guess I have two questions related to what you just said. One is if you can talk a little bit more specifically about neuroplasticity. So when you use the word rewiring, I'm guessing that's what you're referring
Mhm.
to.
Right.
How does the energy lead? So we have the first law of neuroplasticity, what fires together wires together. So is it
Right.
kind of related to that? You're like artificially activating neurons or externally activating the neurons, and then it has the same neuroplastic effect of wiring those impulses that have been directed from the outside, just as if were experiencing something internally.
Right. Yeah, you asked earlier, Ellie, about how does this work?
Yeah.
And arguably, I think we know more about how rTMS works in many ways than we do medication.
Wow.
You give somebody a pill and the drug goes throughout the body, throughout the brain, you really don't know what the site of action is.
Hmm.
For TMS, I can tell you exactly where the benefits start, right under the stimulating magnet on the
And
brain.
you're pointing, I think, to, if I'm reversing this screen correctly, you're pointing to the left side of your
Correct. Yeah.
head.
Our
Yeah.
most common target for depression is in the left front, what's called left dorsolateral prefrontal cortex or
Hmm.
DLPFC. And when I pulse the brain there, I know that that is where the therapeutic benefit starts. Either that or it's magic.
Right.
So when we introduce the pulses there, we can actually see them spread through EEG recordings of the brain activity by looking at fMRI scans before and after treatment. And you can see new and different connections being formed. You
Wow.
raise a very important point about neuroplasticity. Uh, One of the very first effects of rTMS stimulation is to entrain the firing of nerve cells, the brain waves, to the frequency of stimulation.
Okay.
And we entrain them and then we turn off the magnet, the brain relaxes, if you will. We put another train of pulses in, on, off, on, off. By doing that again and again, we are inducing what we call neuroplastic effects and helping to form new connections in the brain and repurposing nerve cells to subserve different emotional and cognitive states.